Hi guys, my name is Michelle. I'm a tutor for Chegg Tutors and I usually teach English, math, and psychology. And today we're going to be talking about psychiatry. So psychiatry is the branch of medicine focused on the diagnosis, treatment, and prevention of mental and emotional and behavioral disorders. So a psychiatrist is a medical doctor, an MD or a DO, who specializes in mental health, including substance use disorders. So they're qualified to assess both the mental and physical aspects of a psychological problem. People need psychiatric help for many reasons. So these reasons might be more sudden, such as panic attacks or hallucinations or thoughts of suicide, hearing voices, etc. Or they might be more long-term, such as feelings of sadness, hopelessness, or anxiousness that never goes away, or problems with functioning, so causing everyday life to feel distorted or out of control. And so to become a psychiatrist, you need to go through medical school and take a written exam for a state license, and then you have to complete 4 years of residency. And so the first year of residency usually involves working in a hospital with patients struggling with a wide range of medical illnesses. And the next 3 years focus on more of the diagnosis of treatment and diagnosis and treatment of mental health and trainings in psychotherapy. To become board certified, so this is voluntary, but to become board certified, the psychiatrist has to complete a written and oral examination given by the American Board of Psychiatry and Neurology, and every 10 years they have to get recertified. So people often mix up psychiatrists and psychologists, and the difference is the fact that a psychiatrist has to complete medical school and residency, and they are essentially medical doctors, and they're certified to conduct and prescribe medications and other medical treatments. Psychologists, on the other hand, they have advanced degrees and extensive training in research or clinical practice, and so they also treat mental disorders with psychotherapy, but they're not allowed to prescribe medication. Because they're physicians, psychiatrists can also order or perform a full range of medical, laboratory, and psychological tests. So combined with discussions with patients, these might help provide a more well-rounded picture of a patient's physical and mental state. This also helps them better understand the relationship between emotional and medical illnesses, as well as the relationship between genetics and family history. So I've been mentioning a word, psychotherapy. So let me talk a little bit about what that is so you have an idea. It's sometimes called talk therapy, and it's basically a treatment that involves a talking relationship between therapist and patient. So it can be used to treat mental and emotional difficulties and help eliminate or control symptoms, helping a patient essentially feel and function better. So sometimes treatment takes 2 weeks and sometimes years, and psychotherapy can be one-on-one or with couples, families, or other groups. So after thorough evaluations in psychotherapy, the psychiatrist is able to prescribe medications that help treat those mental disorders. And so they can correct imbalances in brain chemistry and can be accompanied by more psychotherapy if medications need to be taken long-term. So that's a little bit about psychiatry. I hope you enjoyed your lesson. Have a great day.